good morning, everyone, and thank you so much for joining us. I would like to thank Dr. Newton and the entire team at Bridgepoint for hosting us here today, and I would especially like to thank all of the dedicated staff for your work in dealing with the thousands of patients that you see day in and day out. I'd also like to thank all of you for joining us, but particularly my colleagues, Minister Cho, my parliamentary assistants, Effie Triantafilopoulos, Robin Martin, and of course, Dr. Devlin as well. Thank you so much for being here. I would like to start by telling you a story about a gentleman whose family I met to discuss his health concerns. This gentleman was in good health when he suffered a catastrophic accident that left him in a quadriplegic condition. His family worked incredibly hard with his community hospital to find him a transfer to a place where he could receive rehabilitation services. While he was otherwise stable, he still required a ventilator in order to breathe. So despite his progress physically, the only option he had to access this life-saving ventilator was intensive care. He remained in intensive care for 13 months. Can you imagine that? 13 months, day in and day out, in intensive care. Why? Because there was no other place available to care for him. There was no other place in Ontario that offers rehabilitation services to people with spinal cord injuries who require mechanical ventilation. It actually got to the point where this gentleman no longer wished to live. But for the intervention of his family, he would have been taken off life support. That care was not patient-centered. That care was system-driven. And that's the problem. It's because of stories like this that we are ready to challenge the status quo and years of healthcare inefficiency in this province. I, along with Premier Ford and our entire government, ran on a commitment to end hallway healthcare. It is a commitment that we take very seriously. This has been a defining priority of our government since day one. We have to do more to ensure the healthcare system is sustainable and that high-quality care is here for us when we or our loved ones need it most. Too much time and attention is spent on maintaining a siloed and fragmented system. And far too many people believe it is the patient's or the family's job to navigate this complicated system during what is already one of the most traumatic and stress-filled times of their lives. That is just wrong. Through my time working as an MPP, 6 years as health critic, as Ontario's first patient ombudsman, and now in my capacity as Minister of Health and Long-Term Care, I have heard from literally thousands of you, patients, families, and caregivers, doctors, nurses, and hospital administrators, personal support workers, harm reduction workers, and pharmacists, paramedics, mental health workers, and advocates for vulnerable people. As an MPP, I co-chaired a select committee on mental health and addictions whose report received unanimous support from all members of the legislature. I also co-chaired another unanimously supported all-party select committee on developmental services, which recognized a range of interconnecting issues such as housing, employment, and social supports, and of course, healthcare. From these thousands of hours of conversations, I have heard your collective refrain. Our system is in need of transformational change. Ontarians want their elected officials to put down their polling and finally pick up the mantle of healthcare leadership in Ontario. We are past the point of policy tinkering around the edges that simply shifts capacity problems from one end of the system to the other. More than ever, I've come to deeply understand that the people of Ontario need to know that their government and their healthcare system are working together. Over the last 5 years, Ontario has spent 30% more than the Canadian average on administrative expenses on its healthcare system. Well, I don't know about you, but I certainly haven't seen a 30% improvement in care, nor have the over 1,000 patients receiving healthcare in hallways and hospitals across this province each and every day. In addition, after increasing across the board spending year after year after year, average wait times to get into a long-term care home have ballooned over 300% since 2003, from 36 days to 146 days. We know that in Ontario, healthcare represents 42 cents of every dollar government spends. Yet, we rank poorly on critical factors such as wait times, quality of care, and system integration compared to our provincial counterparts. Right now, care is fragmented. For example, from hospital to home care. Patients, families, and caregivers experience frequent gaps in care and have to reiterate their health concerns over and over again because of a lack of digital tools and care continuity. And for healthcare providers, they are each paid out of different funding envelopes and are discouraged from working together in teams. The fact is that the value of our healthcare system is locked in silos. This is no way to deliver healthcare in our province. And one of the most frustrating aspects of all of this is the fact that Ontario is home to some of the world's best doctors, nurses, and healthcare teams. But we've left them to do their jobs with a patchwork system simply not meant and set up for them to do their best. We hear from healthcare providers that they are ready for a system that encourages collaboration, partnership, and finally frees them from the system slowed by the bureaucracy constructed within it. Our healthcare providers work very hard to provide the best possible care. They work hard to connect us to the services we need, and they do it despite the fact that they have very few tools in order to make that connection. Our providers should be able to easily link us to that care. And once they make that connection, they should already have your health history so you don't have to repeat it time and time again. Imagine we could book appointments online. We can have access to our own healthcare record. And what we could do if we connected the best of what's happening across the system and leveraged those successes for everyone's benefit. Take Cancer Care Ontario, for example. Cancer Care Ontario has built some of the best disease management programs for cancer and renal indications in the world. Imagine if we could amplify that success and take the best practices we have learned from developing these programs to build a larger, more comprehensive chronic disease management strategy. Imagine if we could replicate those achievements to correct the inequities that have led to the development of such a world-class cancer system while leaving our mental health and addiction system with little to no infrastructure at all. Right now, we are leaving Ontarians behind because we have a system that is disconnected. Efforts are not coordinated toward a common goal, but are dispersed and diluted across a system that competes for, rather than realizes the value of, every healthcare dollar. So today is an exciting day. And I have been waiting almost 13 years to say, it's a long time, to say directly to Ontarians, we see you, we hear you, and you finally have a government that is not afraid to build a healthcare system for all of you. It gives me great pleasure to say that today. Because the truth is, we have thousands of dedicated Ontarians working to deliver better health care in Ontario, but the structure of our system is flawed. and that ends now. But one thing I do want to make very clear is our government's commitment to the fundamental right of Ontarians to universal access to a publicly funded system of healthcare. To me, that is part of what is being a Canadian and being a very proud Ontarian. That's why throughout our government's process of developing a vision for our healthcare system, I do want to say very clearly and directly to the people of Ontario that our primary objective has always been and will always be to strengthen our publicly funded healthcare system. And that means paying for your services with your OHIP card. But while universal access to publicly funded healthcare is not up for debate, the structure and effectiveness of our system is. Ladies and gentlemen, today is a new day for healthcare in Ontario, and I'm proud to announce that our plan starts right at home in our communities. One of our key priorities as a government is to deliver local, community-based care unencumbered by bureaucracy. So I'm glad to hear you think that's good news too. So I am here now to lay out our vision for patient-centered community care through the creation of local Ontario Health Teams. Ontario Health Teams would be made up of your local healthcare providers and will be organized in a way to enable them to work as a coordinated group. These teams will be built to guide patients between providers and to shepherd you and your families through those transitions that are so difficult. They would share responsibility for care plans, service provision, and outcomes. And most importantly, they would take the guesswork out of navigating the healthcare system. Through Ontario Health Teams, patients would finally have a say in their healthcare journey. With safeguards in place, of course, to protect information, patients would have an option to securely access digital health services, such as making online appointments, talking to a specialist virtually, or having access to your own electronic health records. And a great part of Ontario Health Teams is that they will rely on leadership that already exists in our community, rather than create another level of bureaucracy and management. And I would like to share an example of this model that's already at work in my riding of Newmarket Aurora at Southlake Hospital through their Southlake at Home program. Southlake Hospital approached me late last year with a proactive proposal for integrated care, specifically around the hospital-home care relationship. Through collaboration, we enabled the hospital to partner directly with home care providers in an effort to transition patients more effectively from hospital and to tackle Southlake's escalating alternate level of care rate, one of the key drivers of hallway healthcare. This is just one example of how community providers are already seeking out opportunities to join forces without interference by a heavy-handed government that thinks they know better than what frontline providers know. And it's these opportunities and relationships we are seeking to empower through the creation of Ontario Health Teams, which will finally put the patient at the center of the provider network. We envision a community-based healthcare delivery model that connects care and includes primary care in hospitals, home care and long-term care, mental health and addiction supports, just to name a few. In fact, it would be great if we connected into our entire healthcare system to be able to work together. The reality is, to build a patient-centered system of care that we so fiercely believe is necessary, we must enable collaboration and coordination from top to bottom. And that includes looking at how best to structure our agencies. Over time, we have continued to add, but not integrate nor coordinate, new agencies and healthcare programs. This approach to system planning has led to the development of many discrete agencies, each working toward a separate vision, following a distinct work plan, and embracing at times divergent views on how to deliver the best possible care to patients. These agencies often focus on specific patient populations or disease states, while the reality is that people are whole individuals who span multiple groups and areas of focus. This is not the fault of any one group, but is our collective failure to demonstrate the courage to take the best of what's working and to make it better. The fact is that world-class programs are being developed and delivered through our various agencies. But once again, we have locked away the value of our system in silos. We have a genuine opportunity, and I would argue responsibility, to amplify the strength of what's working by bringing our resources together and comparing what ideas and successes can be translated to improve other programs, to bring a consistency of approach to our healthcare system, a common vision, a single point of oversight, a united effort to get from where we are to where we need to be. That's why I am also announcing that our government has established a new agency, Ontario Health, to do this important work, to bring the best of our system together and form deep roots that will put our healthcare system on a solid foundation for the future. It will be a single and harmonized home for programs and operations of existing provincial agencies. Ontario Health will begin to take shape this spring, but I do want to stress this is not going to happen overnight. This will be a long-term process. It's going to take time to bring these agencies together and to form a new and more effective organization. But this I do know. It's the right thing to do. If we are truly serious about finally building a healthcare system centered around you and your families, we need to roll up our sleeves and put in the hard work to get there. We need to be bold. We need to be creative, and we absolutely need to work together. Now, I know that what we are announcing today is significant, and that real, meaningful change is never easy for anyone. But I also know what's at stake, which is no less than the future of the healthcare system we rely on and the system we have an obligation to enhance and protect. But the time is now, and I am confident that we have the plan and the team to get it done right. I know that together we will finally build a coordinated healthcare system here in Ontario built around patients. So thank you so much for being here, and I look forward to working with you in the months and years ahead. Thank you.
Good morning, Minister Elliott. Travis Janraj, Global News. Just two broad questions. First off, how much money is the government going to save from this new plan, and what will the job losses look like? Because I'm assuming that there will be job losses as a result of this.
The point of this whole plan is to build care around patients and to center patients and connect them to their care. That's what we're looking at doing, because we know that in many instances there are situations where it costs more money to not be connected. For example, someone who is coming home from hospital doesn't get connected in time with home care. Days go by, complications develop and the person ends up back in the emergency department. That's what we want to avoid. We want to make sure that people feel connected to their healthcare system throughout their journey in healthcare and throughout their lives.
That's great, but just wondering if you could answer specifically on the job losses and also about the cost savings.
In terms of the situation that we're working with to make sure that we are able to connect people to care is going to save money down the road, but it's going to take years for this system to become mature. And in terms of jobs, we know that there are many people that are going to continue in this system. People will continue to access their same care providers. Nothing is going to change for now. People will still go and see their doctors, nurses, community health teams, Aboriginal health access centers. That will continue.
Hi, Minister. I was hoping you could tell us a little bit about the Ontario health teams. What process will be taken to create them? Will they bid on the chance? Will they be reached out to? How will that work?
It will be up to the local healthcare providers in each community to come together to form a plan about how they can connect care for patients in their community. They will then submit that plan for review. We are developing criteria that they must meet, including an adequate care plan to make sure that they meet the objectives that we are setting as a government, and that they will be able to continue to work with patients, family members, and caregivers to make sure that they continue to be involved in that decision making. So ultimately, at maturity, we expect that there will be 30 to 50 local healthcare teams that will be set up, Ontario health teams, that will be responsible for roughly 300,000 people, but that will vary depending upon geographic circumstances. And there will also be some local teams that will actually have more of a provincial focus. For example, children with fragile medical conditions. That will require a bigger focus, but that's what we're looking at. But there will be standards and qualifications that local providers will be required to meet in order to be qualified as local Ontario health teams.
I have a follow-up. I'm hoping you can also clarify on that. So the idea is not that every Ontario eventually belongs to one of these teams? And also, for my follow-up question, how will they be funded and held fiscally responsible? As you know, the NDP's raised some fears that the model, particularly in the hands of a Conservative government, would lead to more for-profit care.
Well, I can put that one to rest right now. There will be no more for-profit care in the system that we are envisioning. What we are looking at is for local health providers to come together in any way that they see fit, either in partnerships or in joint ventures, whatever it happens to be. And if there is any money left over at the end of the year, that will be going directly back into patient care. That will not be going to any private interests. That will be going right back into local community care.
Hi, Minister.
Hi, Cynthia.
You are describing a massive overhaul to the healthcare system. Any plan's success is determined by its implementation.
Yes.
How can you guarantee that patients won't fall under the cracks or between the cracks, and that you're not going to create an even bigger bureaucratic mess?
The whole reason why we are doing this change is to create patient-centered care that connects patients to their healthcare system throughout their lives. So we have had a relentless focus on patients and for them to have a seamless journey, not just when the teams are at maturity, but as we get there. So we have worked very hard to ensure that as we are transitioning into this new system, that patients will be protected, they will continue to access healthcare services as they always have, and that they should not see any change in that whatsoever.
Have you looked at models elsewhere that have been successful in doing this, somewhere in this country, in the US, Europe?
We have looked at some systems that have not been successful and have really worked hard to make sure that we have a Made in Ontario model that learns from those issues and that will be successful. So we've worked very hard to develop this. I think that it's fair to say that we have examined this from 360 degrees. We have looked at many different models. This is the model and the system we know is going to result in better patient care, more connected patient care.
Hi, Minister. Mike Crawley
Hi,
from
Mike.
CBC. How confident are you that family doctors are actually going to be willing to join these Ontario health teams, and what are you going to do to, push them in that direction?
We are very confident that family doctors will be interested in this model. We've had some early discussions. We have had consultations throughout in speaking with doctors, nurses, other healthcare workers, and it's really important for doctors as well as nurses to know what's happening with their patients. So when your patient is discharged from hospital, often doctors don't know what happens to them. This way, the care will be connected and everyone will know. Or the family doctor who may not know that their patient was in hospital, they will be able to find that out now. So this is better communication amongst providers to provide that higher quality care to patients.
In your news release, you talk about how some of the work of these provincial agencies that are being folded into Ontario Health, how some of their work has become duplicative. They each have a full senior management team, back office support, that kind of thing. So this indicates that you think there is going to be some savings by consolidation. So it's back to Travis's question specifically.
Yes.
In the consolidation of the 14 LHINs and the 6 agencies, how many staff do you think you're going to save? Because there are thousands of people that work for those agencies right now. How many fewer staff are going to be there in Ontario Health, or you're just going to have the same number of people all working for one agency under a different name?
Well, I think that we all need to remember that when we were sworn in as government, we promised that we would put more people on the front line in healthcare services, and that's what we intend to do. So that there are people who are working in the LHINs, for example, right now, who provide wonderful home care. We will still need them. Nothing's going to change that way. People will still need home care. We want to make sure that we can amplify those home care numbers. So in the end, it will work out.
So I'm still not hearing an answer to the question, Minister. How many fewer staff are there going to be under Ontario Health?
That is something that we can't answer right now because of the fact that it's going to be up to the local Ontario health teams to structure the care that's going to be needed in that local area. And so we are going to work with those teams to make sure that care is provided across the geographic area to meet the needs of the people that are within that area. What we're trying to do is take away the silos of care to allow the providers and the people in each local community to be able to do their best work without having the structures and the silos that government has imposed over the years.
Minister, I'm not sure if you're misunderstanding Mike and Travis's question here, but I'll read you a line from your own background, or it says, the Ontario Health Agency would enable more efficient use of public health care dollars by eliminating duplicative back office infrastructure and administration. That means layoffs are coming to Ontario Health.
There are many people that are going to be needed to work in many of these areas. It is true that the agency is going to take over the administrative functions for the LHINs and the 6 agencies that are being consolidated into that agency. But that's what we're referring to, is that back office service. But there will still be services that are going to be required in the local Ontario health teams too. So I think we have to look at this as a rearrangement, but rearranged around the patient.
Right,
This
so-
is not a financial exercise. This is an exercise primarily based at connecting patients to their care.
So nothing on the front lines, but certainly back office, there will be layoffs. Can you give us a percentage, an estimate, an average, something, some kind of a figure that allows us to understand how many people will be losing their jobs once Ontario Health is formed?
I did not say anything about that. What I did say is it's going to be a local reorganization of how care is delivered, not within the LHIN structure, but within the local Ontario health team structure. And of course, they are going to need people to operate, to provide care in their community, as well as the need for people to operate the back office functions of Ontario Health.
Good morning. And what will happen to the 6 French entities? Will they merge? What will happen to them?
No, we will still have the agencies in a preamble to the legislation, which I will be introducing this afternoon. We have a commitment to making sure that Franco-Ontarians' health care needs are being met, and that the systems will still continue. That is a priority for me, as well as providing services for our Indigenous people and people from other communities.
So the six
That is a priority.
entities, because the six entities were giving tips to the 14 LHINs, will the six entities survive? Yeah?
Yes,
Okay.
yes,
In
they
the
will.
current moment, yeah.
Yes.
And how will the French services improve then?
To make sure
Yeah.
that they're coordinated, because they're not coordinated right now in the way that they should be through the LHIN structure. So we want the local Ontario health teams to be able to work with the existing réseau, which do wonderful work. And there will also be 5 regional agencies of the Ontario Health too, to make sure that there is regional coordination and coverage, and that the needs of particular areas are going to be covered, particularly for areas where there is a large Franco-Ontarian population.
Hi, just to follow up on this French language issue, there seemed to be a bit of contradictions in the draft bill that we saw where obviously you'd see the LHINs dissolve, but the French language health entities are reporting to the LHINs. Are we going to see the entities remain exactly as they are, or will they need to form Santé Ontario teams?
There have been changes since the document was presented through the official opposition several weeks ago, and so I can't really speak about it yet. I have to wait until this afternoon to introduce it properly in the legislature.
And what will Franco-Ontarians be seeing? Because obviously with reorganizing health services into these Health Ontario teams, that could there could be concerns from the Franco-Ontarian community that there won't be enough to consolidate into full-on teams. How will services and healthcare change for Franco-Ontarians?
Well, I would say that services will improve because they will be better coordinated and managed and will be centered on the patient and the patient's individual needs. And whether they're Franco-Ontarian, Indigenous, or speak another language, it doesn't matter. Care will be coordinated around them. But of course, we are certainly happy to discuss any particular issues you have after the legislation has been introduced. Thank you.
Hi, Minister. I'm just trying to picture how these new local Ontario health teams would work. So about 15 years ago, the big deal was family health teams, where you could go to your family doctor, but it just wouldn't be him or her. It would be maybe there's a nurse practitioner, a dietitian, a physiotherapist, like, different health disciplines in there. So when you talk about a local Ontario health team, what are you talking about? Because I'm trying to imagine an ordinary Ontarian listening to this right now and trying to figure this out in their own mind, how this is going to change how they go to the doctor.
It won't change how they go to a doctor. Family health teams will continue under the old system and under the new system. So people will still be able to have access if they are within a family health team. That will continue. But the idea that we are proposing through the legislation, if passed, is to have Ontario Health be the agency that is responsible for coordinating the care and for making sure that the local Ontario health teams live up to the expectations and the agreement that they will be required to sign with respect to service provision, level of care, and engagement with patients and families. That will need to continue. What will then happen with the local Ontario health teams is that will be a group of providers that will come together. Perhaps it might be a hospital and a nurse practitioner clinic and a mental health team, for example. They will come together. They will have to satisfy the agency that they meet the criteria to become a local Ontario health team, and they will then be fiscally responsible and responsible for the delivery of care to everyone within the geographic area as has been defined. So this is going to happen, as I say, gradually. We've had about 30 groups come to us already to volunteer, but of course they will have to go through that level of rigor and inspection to make sure that they are actually ready to become a local Ontario health team. And then they may be able to scale up over time, but there will be that expectation that they will be the ones that are responsible for all of the care in the area, including what the local local health teams are doing. But the health teams will continue. People will continue to get home care as they always have. They will go and see their physician or nurse practitioner as they always have. This is going to happen over a gradual period of time.
So what are the incentives in the legislation to draw various, a hospital, doctors, clinics, whatever, into this local team? And how big could they be? Toronto's a huge city. How would it differ in Toronto, say, versus London, where it's a population of 300,000 people?
Well, we're looking at a maximum size of about 300,000 people. That's as large as we think is a good size for them to be able to manage all of the care. But in terms of incentives, I can tell you that healthcare providers have been looking for this kind of change. They have been expecting this kind of transformation because they all know that just small tinkering around the edges of our system is not going to bring about the change that we need. The need to coordinate care, the need to put patients at the center, and the need to give providers the ability to provide the care that they were trained to provide. So we know, for example, with nurses, they don't want to be providing care to people in hallways and storage rooms in hospitals. That's not how they were trained. They know that's not excellent quality care. So we want to bring them back to that, to be able to provide that care and to be able to center that care squarely around the patient.
Hi, Minister. A lot of people out there in the healthcare workforce are worried about how this reorganization will affect them. Can people, say, like care coordinators in home care, expect to be moving to different offices, working out of hospitals, working out of primary care places?
There are many roles that can be played by care coordinators. We have excellent people working in our LHINs, including the people who came over from the CCACs. We will still need them. Our healthcare needs are growing. So we're looking at the structure of the system, not the people are great, but we want to make sure that they can provide as much frontline care as possible, because right now in our systems we have too much duplication at the administrative level. We need more on the front line. That's what I've heard from thousands of people, especially during my time as Minister of Health.
Will there be buyouts for any of them?
That will be up to the local health teams once they determine what the needs are for their particular area, to determine and to make recommendations about. It's really, really too early to make that call. But we want to make sure that we can put as many people, as I said before, on the front line as possible.
And in home care delivery, will there be more private delivery of home care services?
We have both private and public delivery of care. That's always been the situation. I don't see any need to change that. It's working very well. But in terms of how the system is going to operate, the system will be based on our public model. People do not need to fear. They will continue to pay for their healthcare services using their OHIP card. I think that is the most important thing. People do not need to be worried about this. In fact, I'm really hoping that people will be excited about this, because we are. We're excited to bring about this change, and our healthcare partners have indicated that they're excited about it too.
We're just going to take
So, Minister, so in the 2018 budget, it was about basically 40% of the budget was spent on healthcare. So since this is going to be implemented over several years, is the goal to actually end up spending less than that, to actually go from 40% to, say, 35%, 30%, or are you going to actually be spending the same amount of money?
Really, the goal of this has always been the patient. That's all I can tell you, that we want to make sure that patients get coordinated care, that they are at the center of it, and they are they continue to be consulted and asked about what they want and what they need in our healthcare system. We haven't done that over many years, and right now patients are feeling very disconnected from their healthcare system. They don't know where to go. When they leave hospital, they don't know. It's a question. Will home care come? When will they come? Who will come? Many questions that patients have that need to be answered, and that's what we're trying to do with this change in the system.
So,
it's for patients.
So just to be clear, a goal is not specifically to save money, it is to spend it better. Is that fair to say?
Exactly. Yes. Yes. Yes, because we spend 42 cents, as you said, of each dollar government connects on healthcare. And study after study shows that we're not getting good value for that. So we want to get that good value and put it into healthcare for patients. Thank you.
Thank you, everybody.
Thank you so much for joining us today.